dear students, today is our fifth lecture of radiotherapy. The subject of our today's lecture is radiotherapy of non-malignant disorders and radiation complications. As you know, cancer is not the only disease in which radiation therapy is useful. Since the early half of the 20th century, radiotherapy has been used to treat a host of conditions, both benign and malignant, not always with an honorable reputation. This appears some public misconception that radiation therapy is used solely for the treatment of cancers. In fact, there is a wide range of conditions that may benefit from radiotherapy. And since the discovery of X-rays, many conditions have been trialed and treated, although not always with the desired outcomes. Treatment for benign conditions has declined over the years due to two main facts. Firstly, the discovery of the late effects of radiation, such as the potential for induction of malignancy, and secondly, advances in surgical techniques and other medical advancements. Today, I shall be talking about the role of radiation therapy in treatment of benign conditions, such as benign tumors and other benign conditions. Radiotherapy has been given successfully to patients suffering from a wide variety of benign disease, such as eczema and psoriasis, abscess, insertion tendinitis and osteoarthritis, ankylosing spondylitis and endocrine orbitopathy, and for the prevention of heterotopic ossifications or of restenosis after transluminal dilatation of blood vessels. Those given for the different indications range from those given in cancer therapy to less than 1% of those doses. Thus, for treatment of benign conditions, we use from less dose of radiation. This suggests that very different radiobiological mechanisms are involved in the therapeutic action of radiotherapy on the different pathological processes. Main indications to providing radiotherapy of non-malignant conditions are acute and chronic inflammatory disease, hidradenitis suppurative, boils, white loss, and other antibiotic refractory infections, and acute or chronic painful degenerative diseases, for example, tendonitis and bursitis of different joints. Soft tissue proliferative disorders, prevention of post-surgical recurrence of tendium or keloids, functional disorders such as Graves' ophthalmopathy, arteriovenous malformations, age-related muscular degeneration, persistent lymphatic fistula, and other. For treatment of skin conditions, for example, such as mesothelioma, and other conditions, for example, for prophylaxis of heterotopic ossification. Okay. The concept of radiotherapy for the treatment of benign disease refers to the use of moderate to high energy ionizing radiation as part of the treatment of non-malignant but not necessarily harmless disease. The usefulness of radiotherapy based on the anti-inflammatory properties of ionizing radiation has been long known. Apart from the treatment of intracranial benign tumors such as meningiomas and neuromas, the prevention of cardiovascular stenosis, or treatment of skeletal degenerative disease are, without doubt, the main fields of action for radiotherapy in benign conditions. And nonetheless, many other non-cancer entities may benefit from ionizing radiation therapy treatment. Concerns about the development of radiation-induced tumors has been the principal cause of its scant acceptance. And nevertheless, the efficacy this therapy has demonstrated, as well as the quality of life improvement among patients, far outweighs the minimum potential risk associated with the therapeutic use of ionizing radiation. Low radiation doses, usually from 2 to 6 gray, at zero point 0.5 gray fraction, are especially efficient in the initial inflammation process, characterized by the development of vasodilatation, edema, and leukocyte infiltration. Vascular endothelial cells play a key role in this process. This mechanism explains the efficacy of low radiation therapy doses in the treatment of synovitis, osteoarthritis, tendonitis, and other processes associated with inflammation of synovial membranes, leukocyte hyperplasia, and lymphocyte infiltration. Okay, antiproliferative effect of radiotherapy for treatment of benign conditions. Mechanism of this action has been used to explain radiation therapy's effect on the prevention of heterotopic ossification following prosthetic replacement, or the prevention of keloid or pterygium recurrence following their removal. In these cases, usually those are typically around 10 gray. And immunomodulatory effect of radiotherapy. Radiation therapy's effect of circulating lymphocytes probably plays an important role. Recommended doses are not well established, but doses less than 10 gray are generally administered. That is, for treatment of non-malignant conditions, three main effects of radiotherapy are important: anti-inflammatory effect, anti-proliferative effect, and immunomodulator effect. Okay. The radiation therapist's primary concern is the treatment of patients with malignant disease. However, there are definite indications for radiation treatment for benign disease that don't respond to conventional methods of treatment. It may be the treatment of choice in the unusual instance of a life-threatening benign disease that can't be surgically or medically managed. That is, we use radiotherapy for treatment of benign conditions just after of surgery or medical therapy. The initial report of the Committee on Radiation Treatment of Benign Disease recommended that consideration be given to the quality of radiation, the total dose, overall time, underlying organs at risk, and shielding factors before the institution of radiotherapy. Infants and children should be treated with ionizing radiation only in very exceptional cases and after careful evaluation of the potential risk compared with the expected benefit. Direct irradiation of the skin areas overlying organs that are particularly prone to late effects such as the thyroid, eye, gonads, bone marrow, and breast should be avoided. Radiation protection techniques should be used in all instances, and the depth of penetration of the X-ray beam should be chosen in accordance with depth of the pathologic process. In this table, you can see mechanism and dose of ionizing rays during providing of radiotherapy of non-malignant conditions. As you can see here, for cellular gene and protein expression, single dose and total dose of radiation is less than 2 gray. And in dose of 0.3 and 1 gray, in total dose from 2 to 6 gray, may appear inhibition of inflammation in lymphocytes. In a single dose of 1.5 to 2 gray and in total dose from 9 to 12 gray may appear inhibition of fibroblast proliferation, and finally in single dose of 1.9 and 3 gray and in total dose from 46 and 16 gray may appear inhibition of proliferation in benign tumors. Before conducting any ionizing radiation therapy in non-cancer disease, a number of considerations should always be borne in mind. That's main indications to providing of radiotherapy for treatment of non-malignant disease. Assessing beforehand the consequences of not providing treatment and the natural history of the disease. That we can provide radiotherapy just after providing of other treatment modalities, for example, surgery or drug therapy. Determining the risk-benefit ratio for each individual patient, both from radiotherapy and the available alternatives. Considering radiotherapy if conventional treatments have not been effective, if the risk from other treatments are greater than radiotherapy's inherent risk, or if the potential implications of not providing treatment are unacceptable. Assessing the long-term risk of ionizing radiation in terms of the total dose, fractions, organs at risk, presence of comorbidities and the patient's age. Obtaining always the patient's informed consent and make sure the patient has thoroughly understood the need, purpose and potential risk of the treatment. Selecting as possible the smallest treatment field and the lowest effective dose. Using multiple treatment fields and beam incidence using appropriate shielding and protection. Planning the treatment using the same criteria for quality and volume definition as used in cancer external beam radiotherapy. Setting an appropriate follow-up which allows for the assessment of both the treatment response and its efficacy as well as the development of late complications. And finally, always advising the patient to obtain a second opinion and or treatment options if there is the slightest doubt about the therapy. These branches, they are so important for providing of radiotherapy of different inflammatory processes and different non-malignant disease and tumors. As with treating cancer, an overarching principle that also applies when treating benign disease is to minimize the volume of irradiated normal tissue. You know that in radiotherapy, our main aim is maximal protection of pathologic area and maximal exposure of pathologic area and maximal protection of surrounding normal tissue. And Current radiotherapy techniques can help to achieve this. For instance, modern imaging can allow more accurate target definition, and other developments in immobilization and image guidance can allow reduced margins. Techniques such as intensity modulated radiotherapy can achieve better conformality to complex target volumes, although this may increase the volume of tissue receiving lower doses. In some sites, particularly the school-based dose distributions achievable with proton therapy may have advantages. It is important to note that there are currently only limited data regarding the application of modern radiotherapy techniques to the treatment of benign conditions, including the implications for treatment risk from radiotherapy, such as intensity modulated radiotherapy. Now I will explain radio treatment principles of different disease. First of all, I will say about disease of nervous system. With ionizing rays, we can treat different benign tumors and sometimes different inflammatory process of nervous system. Okay. For treatment of non-malignant disorders are used from different types of radiotherapy. First of them is intensity modulated radiotherapy, in which computerized technology shapes the size and length of multiple beams, which are then directed at a tumor from a machine located outside the patient's body. Next type is proton radiation therapy, which is a type of external beam radiotherapy that use powerful beams made up of protons to destroy abnormal cells. This can be an especially effective option for treating tumors and different non-malignant conditions situated deep within the skull or near the skull base. Stereotactic radiosurgery, in which narrow beams of radiation are focused on a very small specific area during a single session. This type of radiation therapy can sometimes be used in place of traditional surgery. And fractionated stereotactic radiotherapy, which is virtually identical to stereotactic radiosurgery but administered over the course of several days rather than in a single dose. Okay, now I will explain about radiotherapy of different non-malignant disorders and benign tumors. For example, among of nervous system disease, radiotherapy may be used for treatment of meningioma, pituitary adenoma, chordoma, acoustic neuroma, arteriovenous malformations. One of these diseases is meningioma. Meningioma is most common benign tumor of brain. Peak incidence is 6th and 7th decade of life. For diagnosis of meningioma, so important methods are tomographic methods, and they appears usually well circumscribed pathologic region, as you can see here. Surgery is main treatment method of meningioma, but primary radiotherapy is used where complete resection is not possible, and in patients with poor candidate for surgery. That's at first stage, usually for treatment of meningioma is used surgery. After that, radiotherapy, but primary radiotherapy is used just where complete resection is not possible. Okay. Radiotherapy also can be used for treatment of different inflammatory processes. You know that one of principle of using ionizing rays for therapy of inflammatory process is their anti-inflammatory effect. For example, for treatment of paraproctitis. What is it? Paraproctitis is a purulent inflammation of the cellular tissues surrounding the rectum. The most frequent cause is penetration of bacterial flora from the rectum into the surrounding cellular tissue, which may occur through an anal fissure. The inflammation is sometimes limited to the formation of an anorectal abscess, and in some cases it spreads for a considerable distance and may be complicated by sepsis. The signs are acute pain in the rectal region, tenderness during defecation, and other. An enlarged abscess may burst and fistula form. The disease becomes chronic after recurrences. Treatment includes administration of antibiotics and anti-inflammatory agents, and in the suppurative stage, surgical lancing of any anorectal abscess. But radiotherapy for paraproctitis can be performed during the infiltration phase or after surgical removal of the pus. In any case, radiation therapy may be prescribed if the parapractice becomes chronic, if it resists slow, conservative treatment, and if it does not heal surgically. Post-operative radiation therapy eliminates perifocal inflammation, accelerates the cleansing of necrotic tissues, activates regeneration, and as a result closes the spleen. That is, they all are treatment effect, principles of treatment effect of radiotherapy for treatment of paraproctitis. Radiotherapy may be used for treatment of different disease orbits and optic apparatus, such as Graves' ophthalmopathy, pseudotumor, choroidal hemangioma, and pterygium, and age-related macular degeneration. One of them is Graves' ophthalmopathy. This pathology is fibrovascular degenerative process arises from conjunctival corneal junction. Surgery is primary therapy of this pathology, but recurrence rates are high. Post-operative radiosurgery using with strontium and yttrium, they are beta-emitting radio sources, radioactive materials, contact applicators, reduce recurrence rates significantly to 20% or less. Local control is best when the radiation is given immediately after surgery, and radiotherapy as a non-surgical treatment and for reducing size is important treatment options of during therapy of fibrovascular during therapy of Graves' ophthalmopathy. Okay. Radiotherapy method we can use also for treatment of pathologies, the head and neck regions such as paraganglioma, nasopharyngeal angiofibroma, and trigeminal neurology. Okay. One of these pathology is trigeminal neurology. This is a chronic pain condition that affects the trigeminal or fifth cranial nerve. Trigeminal neuralgia is a nerve disorder that causes abrupt, searing or electric shock-like facial pains. Most commonly, The pain involves the lower face and jaw, but signs can also appear near the nose, ears, eyes, or lips. The pain occurs because of a change in neurological structure or function caused by irritation or damage of a nerve. Non-invasive stereotactic radiosurgery has been reported to be a viable treatment option for trigeminal neuralgia since firstly introduced by Luxel. Radiosurgery treatment for trigeminal neuralgia is the least invasive surgical option. In fact, it's technically not surgery at all. The gamma knife is a device that delivers precise controlled beams of radiation to targets inside the skull, including the brain and associated nerves. For trigeminal neuralgia treatment, the radiation beams are aimed at the trigeminal nerve where it enters the brainstem. Gamma knife treatment does not target the root cause of trigeminal neuralgia, but instead damages the trigeminal nerve to stop the transmission of pain signals. The procedure requires little or no anesthesia and is performed on an outpatient basis. This procedure provides significant pain control or reduction in approximately 19% of patients, but response is usually slower than for other treatments. Patients may respond within from 4 to 6 weeks post-treatment. However, some patients require as much as 3 to 8 months for the full response. Most patients remain on full doses of medication for at least from 3 to 6 months after treatment, and we don't typically start the paper trigeminal neuralgia medications until pain relief has been achieved. That's for treatment of trigeminal neuralgia. We can use from radiotherapy, from stereotactic radiosurgery, from therapy with gamma knives. Okay. For treatment of different skin and soft tissue disease, radiotherapy methods are so useful. For example, for treatment of keloids, hypertrophic scar, desmoids, and other conditions, we can use from different radiotreatment methods. For example, one of them is keloids. Keloids is excessive tissue proliferative disorder from surgery, burn, heat, and inflammation, as you can see here. Surgery has recurrence rate from 15 to 100%. Immediate preoperative radiotherapy is most effective and reduces recurrence rate to from 20 to 25%. And usually dose of radiation for treatment of keloids is with single fraction from 7.5 to 10 gray or from 12 to 20 gray in 4 and 3 or 4 fractions. Radiotherapy initiated 24 hours after with scar and 1 centimeter margin. In this picture you can see keloid behind ear lobule before or and after providing of radiotherapy. Okay. Radiotreatment options methods we can use for treatment of different disease of skeletal system also. For example, aneurysmal bone cysts, pigmented villonodular synovitis, and myositis ossificans. One of them is aneurysmal bone cysts. This is vascular osteolytic cystic lesion in metaphysis, as you can see here. On this X-ray film you can see in distal metaphysis there is aneurysmal bone cyst. Complete resection or curettage cause recurrence of 16%. Unresectable or post-curettage stage when patients need usually radiotherapy. Progression and recurrence phase also need radiotherapy. Usually radiotherapy methods can provide in young age with from 10 to 20 gray fractionated radiotherapy. Sometimes radiotherapy may be used for treatment of degenerative disease of joints. Degenerative osteoarthritis can affect any joint, being hands, knees, feet, and hips most commonly involved. The pathophysiology of degenerative osteoarthritis consists of a progressive destruction of the articular cartilage, which result in chronic inflammation and other changes that affect the synovial membrane of the periarticular joint, bone, and muscle. For diagnosis of them, so important methods are plain radiography and magnetic resonance tomography. When osteoarthritis evolves, radiological changes such as loss of joint space, as you can see here, subchondral bone sclerosis, and the presence of osteophytes bone spurs are observed. You can see osteophytes, and for treatment of them, low-dose radiotherapy has been used for treatment of this pathology. Okay, low-dose radiotherapy for painful degenerative skeletal disorders is effective in the majority of the patients, and therefore it may be reasonable therapeutic alternative when simple and non-invasive methods have been used without persistent success. For all discussed entities, single fraction dose of 0.5 to 1 grade and total dose of from 2 to 6 grade series applied with 2 or 3 fractions per week are recommended. Okay, summary of radiotherapy of non-malignant disease. First, ionizing rays can be used for treatment of different non-malignant conditions, that's non-malignant disorders and benign tumors. Second, the radiation dose for treatment of non-malignant conditions is less than malignant tumors. And finally, for treatment of non-malignant disorders, the radiotherapeutic methods must be used just after providing an ineffectivity of other treatment modalities, for example, surgery and drug therapy. Radiation complications. Several biological effects can result from ionizing radiation. This can be due to direct and indirect mechanisms, and they can be acute or delayed. Acute effects occur with exposure to high-level radiation. Delayed effects may appear after a long time and include cancer, genetic effects, effects on the unborn child, and other effects such as cataracts and hyperthyroidism. Side effects like skin tenderness are generally limited to the area receiving radiation. Unlike chemotherapy, radiation usually doesn't cause hair loss and nausea. Most side effects began during the second or third week of treatment. Side effects may last for several weeks after the final treatment. Many cancer treatments are aggressive. In general, to accomplish the goals of treatment, we usually need to accept at least some toxicity. Cancer is complex and requires a multidisciplinary approach. We all care for cancer patients. The burden for patient and family is not only physical, but also psychosocial and financial in nature. Seems to be general confusion about the expected side effects of a radiation treatment. Many patients have comorbid issues not related to radiation. Being able to differentiate between expected and non-expected side effects will allow us all to better care for our patients. Okay, different tissues take different times to express damage. This depends on their turnover time. On this basis, normal tissues can be divided into acute, transient. Clinic effects start from 10 to 14 days after initiation of therapy and start to resolve slowly from 10 to 14 days after radiation is completed. Gut, skin, bone marrow, and mucus. And late clinic side effect starts more than 6 weeks after initiation of therapy, may be transient or permanent. For example, brain, spinal cord, kidney, lung, and bladder. Short-term side effects results from destruction of some stem cells in the compartment of rapidly dividing epithelial tissues. For example, skin, gut, oral mucus, bone marrow. The result is inflammation and sloughing of the epithelial tissue. The stem cells regenerate at the end of treatment, and the tissue typically heals well. Also, local inflammation results in leaky vessels, leading to edema, hyperemia, warmth, and occasional pain flare. Late effects of radiation, that long-term effects, can include fibrosis and end organ damage. There are well-described cascades of cytokines which directly injure parenchymal cells and indirectly lead to necrosis, fibrosis, by causing subendothelial damage in blood vessels, eventually leading to radiation-induced arteriosclerosis. Nearly all patients will experience some level of fatigue during and after radiation is delivered due to the pro-inflammatory cytokine cascade. Level of fatigue varies per size of the radiation field volume, individual sensitivity, activity level, and nutritional status. Okay, in this picture you can see classification of organs at risk. As you can see here, they are classified as serial. Whole organ is a continuous unit and damage at one point will cause complete damage of the organ, for example, spinal cord, digestive system, so even point that is significant. And parallel organ consists of several functional units, and if one part is damaged, the rest of the organ makes up for the loss. For example, lung, bladder. Dose delivered to a given volume or average mean dose is considered. Okay. In this picture, you can see example for erythroderma after several weeks of radiotherapy, as you can see here. And The delivery of external beam radiation treatments is painless and usually scheduled 5 days a week for 1 to 10 weeks, as you know. The effects of radiotherapy are cumulative, with most significant side effects occurring near the end of the treatment course. And side effects usually resolve over the course of a few weeks. And in this picture you can see one example of radiation side effects, erythroderma. Okay. Side effects during the treatment vary depending on site of the treatment and affect the tissues in radiation field. They are breast, such as swelling and skin redness side effects, abdomen, chest, head and neck, brain, pelvis, prostate. Fatigue is often seen when large areas are irradiated. Unlike the systemic side effects from chemotherapy, radiation therapy usually only impacts the area that received radiation. Modern radiation therapy techniques have decreased these side effects significantly. Okay. Widespread side effects of radiotherapy, local side effects of radiotherapy are fatigue and alopecia, and in 10% risk for worsening edema. Okay, sometimes after radiotherapy can appear hemorrhagic duodenitis, as you can see here. Radiation-induced hemorrhagic duodenitis in endoscopic method, it is visible. Sometimes after radiation maybe appear radiation-induced liver disease, as you can see here. In computer tomographic scan you can see this liver region. And after radiotherapy, oral damage is develops in 4 grade. In this picture you can see grading of these side effects. At first grade, just soreness and erythema. In second grade, erythema, ulcers, patient can swallow solid food. In third grade, ulcers with extensive erythema, patient can't swallow food. And finally, in fourth grade, mucositis, to the extent that alimentation is not possible. The side effect of radiotherapy of oral cavity. The side effects of radiation in pediatrics also we divide in 2 parts, major late effects and other late effects. Major late effects are cardiotoxicity and second malignancy, and other late effects are thyroid dysfunction, pulmonary fibrosis, peripheral vascular disease, muscle arthropathy, and growth abnormalities. Okay, one of widespread side effects of radiation is radiation alopecia, it is loss hearing. Usually, this side effect improves after 3 weeks irradiation with 5 gray of summer dose and recovers after 6 from 6 to 10 weeks. Radiation therapy will generally cause hair loss to the body part that is being treated. For example, if arm were treated with radiation, patient may lose any hair on arm, but the hair on head would not be affected. The degree of hair loss will depend on several factors, including the size of the area being treated and the total dose of radiation being given. Hair loss is greatest within the treatment field but may also occur in the area where the radiation beam exits the body. Chemotherapy drugs also can cause hair loss. The mechanisms of persistent radiation-induced alopecia are not well understood. However, studies show that substantial insults from radiotherapy or cytotoxic chemotherapy can damage epithelial hair follicle stem cells in the bald region and the rapidly dividing hair matrix cells in the hair follicle bulb, causing damage that is histologically consistent with non-specific scarring alopecia. Hair follicle radiosensitivity also depends on hair cycle stage. Anagen matrix cells are more radiosensitive than telogen matrix cells as they have different proliferation rates. Okay. Other side effect of radiotherapy is radioepithelitis or radiation dermatitis. It happens when radiotherapy damages the outer layers of person's skin. An estimated 95% of people who receive radiotherapy will have some form of radiation dermatitis, including redness, skin dryness, or skin peeling. Radiation dermatitis can vary in severity. Some people will experience mild redness and itchiness, while others may suffer painful, broken skin that is prone to infection. The effects of radiation dermatitis typically arise within a few days or weeks of starting radiotherapy, depending on the dose of radiation and the person's skin sensitivity. Signs of radiation dermatitis include skin redness or pinkness, known as erythema, skin swelling or edema, dry peeling skin called dry desquamation, skin that thins and weakness called moist desquamation, blisters or skin ulcers. As the severity of radiation dermatitis varies between people and radiation doses in the following grades. Grade 1, faint redness and skin peeling. Grade 2, moderate redness and swelling, skin thinning in the skin folds. Grade 3, in this picture you can see grade 2 and grade 3, skin thinning more than 1.5 centimeters across, not just on the skin folds plus severe swelling, and grade 4, death of skin cells and deep skin ulcers. Sometimes these effects can also develop weeks or years after radiotherapy has finished. This is called radiation recall. Okay. Radiation pneumonitis is inflammation of the lung caused by radiotherapy to the chest. It most commonly develops from 1 to 3 months after treatment is over, but it can happen up to 6 months after treatment. Chronic pneumonitis can lead to permanent scarring of the lungs, and we name it pulmonary fibrosis. Signs of radiation of pulmonary fibrosis include fever, cough, chest congestion, shortness of breath, chest pain. If signs get worse or don't go away, patient must report them to doctor or to doctor, and in this situation must provide computer tomography. On computer tomographic image you can see specific picture of pulmonary fibrosis. Okay. While it tends to happen about 4 to 12 weeks after radiation treatment, it can develop as early as 1 week after treatment. In other cases, it develops very slowly over the course of several months. Okay, in this picture you can see computer tomography and PET scan of radiation pneumonitis. Computer tomography, lung cancer, after 3 weeks after high dose chemoradiation, as you can see here. You can see radiation pneumonitis areas, and PET scan at 3 weeks showing inflamed area of radiation. One of complications of radiotherapy is radiation myelopathy. Myelopathy is a rare but serious complications of radiation therapy. Radiation myelopathy is white matter damage to the spinal cord developed after a certain period of application of ionizing radiation. Factors such as radiation dose and time between applications affect the occurrence as well as the severity of myelopathy. Radiation myelopathy is divided into 4 categories according to the clinical spectrum: acute paraplegia or quadriplegia, lower motor neuron findings, acute transient radiation myelopathy, and chronic progressive radiation myelopathy. In this picture, you can see a patient with a history of radiotherapy due to esophagus cancer who complains of paresthesias and discrete loss of strength in the lower limbs and Lermit sign. And sagittal, it is a magnetic resonance. These are magnetic resonance images. Sagittal T2 image of the dorsal spine with discrete fusiform thickening of the spinal cord showing high intensity signal and post-radiotherapy bone marrow changes, as you can see here, and follow-up MRI after 16 months with evidence of partial regression of post-radiation myelopathy. PET scans may be used for differential diagnosis of radiation myelopathy from primary spinal cord lesions and spinal metastasis. MRI is more sensitive than computer tomography for spinal cord lesions, and MRI may be normal in radiation myelopathy. Suggested features are intramedullary hyperintensity on T2 sequences, marginal heterogeneous enhancement in T1 post-contrast sequences. Central region of spinal cord is more affected as it contains spinal gray matter with myelinated tracts at the periphery. Okay. Other complication of radiotherapy and side effect of radiotherapy is lymphedema. Lymphedema is the abnormal buildup of fluid in soft tissue due to a blockage in the lymphatic system. The lymphatic system helps fight infection and other disease by carrying lymph throughout the body. Lymph is a colorless fluid containing white blood cells, and lymph may also be called lymphatic fluid, as you know. And lymphedema is the abnormal buildup of fluid in soft tissue to a blockage in the lymphatic system. There are several types of lymphedema. Mild type of lymphedema can occur within a few days after surgery and usually last a short time. Lymphedema can also occur about from 4 to 6 weeks after surgery or radiation and then go away over time. The most common type of lymphedema is painless and may slowly develop from 16 to 24 months or more after surgery. It does not get better without treatment. Okay, Radiation ulcers are wounds caused by acute or chronic effects of ionizing radiation. The injury may involve the skin, underlying soft tissue, and even deeper into bones, as you can see here. In conclusion, I will say that radiation complications depend on a variety of factors, including total dose of radiation, volume of field of radiation, surrounding normal tissues, and host factors including comorbid conditions, lifestyle, and genetics. Now, I would like to talk about radiation sickness. Radiation sickness is also called acute radiation syndrome or radiation poisoning. Radiation sickness is not caused by common imaging tests that use low-dose radiation such as X-ray or computer tomography. Although radiation sickness is serious and often fatal, it's rare. Since the atomic bombings of Hiroshima and Nagasaki, Japan, during Second World War, most cases of radiation sickness have occurred after nuclear industrial accidents, such as the explosion and fire that damaged the nuclear power plant at Chernobyl, Ukraine. The body response to a large acute dose manifests itself in the acute radiation syndrome. The body consists of cells of different radiation sensitivity, as you know. A large dose of radiation delivered acutely does large damage than the same dose delivered over a long period of time. Acute radiation syndrome, the first signs of them show up after 6 hours. These symptoms subside during the latent period, which lasts between 1 and 4 weeks, and is considered an incubation period during which the organ damage is progressing. The latent period ends with the onset of the clinical expression of the biological damage, the manifest illness stage, which lasts 2 to 3 weeks. Survival of the manifest illness stage practically guarantees full recovery of the patient. Okay, for chronic radiation illness, characteristics there is a slow increase of severity of damage and more long period of rehabilitation. The clinical picture is characterized by the expressed asthenic syndrome and moderated quantity decrease lymphocyte and other uniform elements of blood. At an internal irradiation, the consistency of chronic radiation illness depends on distribution radionuclides in bodies and their radiosensitivity. Okay. In this picture, you can see a radiation hazard scale, and this scale is for description of the radiation hazards. As you can see here, in category 5 means that radiation doses are dangerously high and potentially lethal. High dose of radiation can cause massive damage to organs of the body and kill the person. The exposed person loses white blood cells and the ability to fight infections. Diarrhea and vomiting are likely. Medical treatment can help, but the condition might still be fatal in spite of treatment. An extremely high dose of radiation, the person dies within hours. Category 4 means that radiation doses are dangerously high and can make people seriously ill. Radiation doses are not high enough to cause death, but one or more symptoms of radiation sickness may appear. Category 3 means that radiation doses are becoming high enough where we may expect increased risk of cancer in the years ahead for people who are exposed. Leukemia and thyroid cancers can appear in as few as 5 years after exposure. Other types of cancer can take decades to develop. Studies have shown that radiation exposure can increase the risk of people developing cancer. This increased risk of cancer is typically a fraction of 1%. The lifetime risk of cancer for the population due to natural causes is approximately 14%. The increase in risk of cancer from radiation depends on the amount of radiation, and it becomes vanishingly small and near zero at low dose of radiation. Category 2 means that radiation levels in the environment are higher than the natural background radiation for that geographic area. However, these radiation levels are still too low to observe any health effects. When radiation levels are higher than what we normally have in our natural environment, it does not necessarily mean that it will cause us harm. And finally, category 1 means that radiation levels in the environment are within the range of natural background radiation for that geographic area. Low amounts of radioactive materials exist naturally in our environment, and we name it natural radioactivity: food, air, water, and consequently in our bodies. We are also exposed to radiation from space that reaches the surface of the Earth. These conditions are natural, and this radiation is called the natural background radiation. Okay. And finally, I would like repeat biological effects of ionizing radiation again. That's biological effect of ionizing radiation we divide in two main parts: determined effects and stochastic effects. Determined effects, they are somatic effects as acute radiation disease, chronic radiation disease, radiation combustions, alopecia, ray cataract, clinical registered disorders of hematopoiesis, and temporary or constant sterility. But stochastic effect also we divide in two parts: somatostochastic effect and genetic effects of radiation. Somatostochastic effect is cancerogenic effect and teratogenic effect, but genetic effects are genetic mutation and chromosome aberration. Radiotherapy causes side effects because it affects healthy tissue as well as cancer cells. Healthy tissue is better able to recover than cancer cells, but may be damaged by the radiation in the short or long term. Although most side effects are temporary, some may be permanent and some can appear months or even years after treatment finishes. Okay, that is all. We already finished our radiotherapy lectures. I tried to explain main principles of radiotherapy for you. If you have questions, you already know my address. Please write me. Thank you for your attention.